Welcome to Insurance Basics, presented by Indiana Family to Family. Indiana Family to Family is the parent-to-parent organization and family-to-family health information center for the state of Indiana. These centers are statewide, family-led organizations that assist families of children and youth with diverse health and mental health needs, as well as the professionals who serve them. We provide one-on-one peer support, information, education, training, and outreach. The information in the following video is current as of April 2026. As with any resources or information, it's important to verify the information provided to ensure it meets the same needs as your family's respective situation. Managing a medical condition can be challenging, so knowing how to use your insurance plan is critical so that you're prepared when you need care. In this video, we will define some basic insurance terms such as premium, deductible, coinsurance, copayment, provider network, provider's out-of-pocket limit, and max coverage limits, as well as an explanation of benefits. The premium is the cost of the insurance plan, and typically premiums are paid monthly. The deductible is the amount that must be spent by the policyholder on covered healthcare services before insurance coverage can begin. Deductibles typically start over at the beginning of each year, which is usually on or around January 1st. Coinsurance is a form of cost sharing once the insured person has met their deductible. This means the insurance will cover a certain percentage of the cost of services and the person will pay the remaining percentage. For example, if a doctor charges $100 for a service and the insured person's coinsurance is 30%, the insured person pays $30 while insurance pays $70. The copayment is a set dollar amount that an insured person must pay for a specific healthcare service. Copays are another form of cost sharing. Insurance plans may require copays for visits to the doctor, urgent care, and the emergency room. Additionally, many plans will have copays established for hospital stays, prescription drug benefits, as well as other services. Some insurance plans will use both copayment and coinsurance cost-sharing methods. Please note, copayments and/or coinsurance may not count towards a deductible, so always check your plan to know for sure. A provider is a person or business that provides healthcare services. Network providers or in-network providers are those that have a contract with your insurance plan. Examples include specific hospitals, pharmacies, or physicians. As such, insurance coverage and benefits may be limited to in-network providers. Providers that are not contracted with your plan are sometimes called out-of-network. In general, you may pay less for medical care provided by an in-network provider rather than an out-of-network provider. Out-of-pocket limit or maximum is the most money the insured person must pay during a policy period. A policy period is typically 1 year. This is before the cost of covered healthcare services is paid in full or at 100% by the insurance. Out-of-pocket maximums usually include copayments and deductibles, but do not include premium payments. Coverage limits restrict the number of certain covered services. For example, your plan may only cover 20 sessions of speech therapy per year. The explanation of benefits, or the EOB, is a statement from your insurance company that provides an overview of any medical charges and how much you and your plan will pay respectively. Now let's discuss some tips for using your insurance plan. First and foremost, always get a copy of your plan for your records, or at least know where to access them online so that you can reference them as needed. It's also a good idea to know the basics of your plan, like your deductible and copay or coinsurance amounts, so that you can be prepared to cover costs of care. With many plans, you must choose a primary care physician or PCP. This is your main doctor who provides non-emergent care such as well visits, screenings, or even more acute care when you have a minor illness or infection, or when you have a health problem that requires additional testing or treatment. Your PCP can do an examination, order tests, and then make a referral to a medical specialist if needed. From there, you will need to determine which physicians in that specialty area are in network for your plan and make an appointment. This is important to note, as any out-of-network specialist will likely be more out-of-pocket expense for your family, so always aim to be seen by an in-network physician when able. In the event of a life-threatening emergency, always call 911 or go to the nearest emergency room. After an examination with a PCP or specialist, or even an ER visit, you may need a prescription for medication to be filled at a pharmacy. Review your plan to determine pharmacy options and coverage information, including any copays. Some plans have a separate deductible for prescription medications. Some services, such as surgical procedures, therapy or rehabilitation services, hospitalizations, medical equipment, and more, may require something called pre-authorization, also known as a PA or pre-certification, from your insurance company before they are covered. Always review your insurance plan and work closely with your provider's billing office to manage your coverage. Additionally, make sure to review your insurance plan to determine how to access mental health services and in-network providers. If you are experiencing a mental health emergency, call 988 or go to the nearest emergency room. Your insurance may also include vision and dental coverage. Some employers offer these add-on options, and the employee may pay all or part of the premiums. Review your policy to determine if it offers vision or dental benefits. If your plan denies payment for medical services which you believe are covered, you may file an appeal with your insurance company. If you are unable to resolve the problem with your insurance company and need further assistance, you may contact the U.S. Department of Labor for self-funded plans at 312-353-0900 if you live in northern Indiana, or 859-578-4680 if you live in southern Indiana. For fully insured plans, you will contact the Indiana Department of Insurance at 800-622-4461. And if you're not certain what type of plan you have, contact your employer's benefits administrator or call the number on the back of your insurance card for more information. Additional information on this topic, as well as others, can be found on the Indiana Family to Family website at inf2f.org. While we are not health insurance navigators, we can help you understand insurance information and are happy to connect you with other resources or organizations who may offer insurance navigation. For one-on-one support, you can complete the form found on the Connect page of our website. You may also call us at 844-323-4636 or email us at info@inf2f.org.